We are changing the culture of residency and the laws that affect our patients. We're protesting and lobbying and leading the charge on resident working conditions. With many patients in poor health due to low incomes, CIR members joined the Fight for 15 rallies around the country this year and spoke with legislators about raising minimum wages, gaining victories in New York, California, and many individual cities. We've also secured victories for paid family leave, advocated for laws to discourage tobacco use, won access for Massachusetts residents to the prescription monitoring program, and urged for an end to the ban on gun violence research.
It is our communities of colors, our African American population, Latino population, and our Native Americans that have been targeted by the tobacco industry.
143 residents from New York hospitals taught classes on healthy eating and exercise habits to children from 3 elementary schools and 3 after-school programs this year, reaching more than 400 kids.
This is actually my 5th session of doing the Family Health Challenge. I just want to say that it is such an honor, privilege to be a part of something special again. Teaching the young ones about making healthier choices, proper decisions, and passing that on to their family. I consider them to be my colleagues, and this is how prevention begins.
Residents at Jackson Memorial Hospital held a QI conference last May and later dispersed a number of grants to their colleagues from their $125,000 QI fund. Los Angeles County residents held their first annual resident leadership conference addressing QI as well as career development. Residents at the University of New Mexico continued building on their legacy of QI work by publishing their 5th annual QI journal this year, which represents a roundup of quality improvement education and projects done by residents at UNM and around the country. Meanwhile, Boston Medical Center residents held a CIR Quality Council debate to ask the question, does a focus on patient satisfaction improve overall quality of care? And later on, they presented posters at the annual Institute for Healthcare Improvement Conference. Every CIR region has continued to hold Women in Medicine events, bringing together physicians from across hospitals and specialties to discuss issues faced by women in healthcare and build a strong network. There have been social events hosted throughout the country as well, such as the Southern California Intern Welcome Mixer, the Brooklyn Halloween Party, Children's National Medical Center Holiday Party in DC, and the opening of the new and improved Boston Medical Center's Residence Lounge. There were also several events to celebrate contract victories. Residents at the University of New Mexico won permanent patient care funds and QI funds worth $130,000 over 2 years. Cambridge Health Alliance residents will see a 3% salary increase plus bonuses in their new contract. The house staff at Valley Consortium in Modesto won a board review class for family medicine residents and a special equipment allowance for orthopedic residents. Their neighbors at Santa Clara Valley Medical Center are receiving a 15.25% wage increase over 5 years. CIR members at Jackson Memorial Hospital won additional money for their professional allowances and healthy food options. Los Angeles County residents will see a 10% increase over 3 years and an unprecedented $300,000 fund for resident-driven quality improvement projects. Residents at Rowan SOM fought a 2-year battle for their new contract, banding together through their effort and taking their fight to the public.
We work an average of 80 hours a week every week. We cure cancers and transplant organs. I stand here today to ask Rowan to respect your physicians and to work with us to settle a fair contract now.
They came away this year with increases to their salaries, educational allowances, and conference reimbursement. Elmhurst members will see a number of great new items, including 10% increases over 3 years, ratification bonuses, and new language protecting call rooms. Residents at St. Mary Medical Center in Long Beach negotiated language on meal plans, parking, educational allowances, and a patient care fund, while those at St. Mary's Medical Center in San Francisco secured salary increases, a housing allowance, an increase to their educational fund, and a patient care and QI fund. After 2 years of negotiations, UC Irvine residents came away with a big victory in the first CIR contract ratified just this week. The contract contains 2 big firsts. for UCI residents, a housing allowance of $2,900, and minimum standards for meal and educational benefits across all departments. It's been an amazing year for CIR, full of huge victories and great leadership by our members, who are continuing to use the legacy of the force of a union to advocate for physicians, patients, and communities.